total T4 and free T4 by ED. People always talk, well, what should I run next for the test? So let's talk about that. Thyroid activity is related to unbound T4 and T3. Euthyroid and hyperthyroid cats have similar amounts of unbound or free T4. Euthyroid cats being that they might be euthyroid sick. They will have the same amount of unbound, okay, T4. So and the hyperthyroid sick actually is when they come down, but they're very similar, and I'll talk about that next slide. The total T4 seems to be the best measure, but it does have its false negatives, okay? So the older cat should be in the lower 2/3 of a normal range, all right? So the older cat in the upper third of a normal value, and you're worried about hyperthyroidism? Probably is, okay? Because they really shouldn't be in that range. As they get older, their T4 should be dropping down. There are natural fluctuations, so you can have a cat that's clinical, but on the day you test it, it's actually in the normal range, and then it pops up on a different day. So checking that again if you're really suspicious of it. Do another test. Concurrent disease, hyperthyroid sick, so then the T4 actually will drop into the normal range at the time because they have something else going on. The higher GFR actually will lower their T4. They're pushing through so much stuff. They have kidney disease, and they also have this higher GFR with hyperthyroidism. Their T4 is actually dropping. Yep.
Higher T4, that be fluctuation and be normal, higher
There's going to be outliers, yes. There's going to be the outliers in terms of the bell-shaped curve. But the thing that you want to keep in mind on this, clinical signs. That's the number one thing that trumps all.
There's no clinical signs. You get high T4 with T4 next day.
Yep. And we actually, that brings up a great point because we actually have a cat. It should be here, but I'll tell you about it right now. We have a cat that's in there right now that came in for an I-123 scan because that T4, we treated him 6 months ago. We redid his thyroid scan. We can't find his active tissue. And so we don't know where it is. So we're doing an I-123 scan on him, which is different. Technetium is what we typically do. It has a shorter half-life. It looks like iodine. It gets taken up into the thyroid, and then it shows itself. The iodine-based radionuclide for diagnostic has a longer half-life, but it actually gets taken up and then organified, so it will accumulate in there. And so we can't find on this guy. We're hoping that the I-123 scan will do it. So if you're ever wondering, this goes into functional disease. There's two ways to describe functional. One is it actively taking up iodine? The second one is it actively producing T3, T4? So you can use iodine to make that distinction, I-123, because if it's taking up iodine, it will take up technetium. But if it's using it then to organify and produce T4, then you have to use the iodine because then it gets wrapped up into the whole thing. The technetium doesn't. So.
Does that technetium test also shows a inflammatory process in the kidneys?
No, it won't, but there are different ways to put technetium and label that. That's the most common diagnostic use, and you can label that technetium with so many different things. So you can put antibiotics on technetium and send it back into the body, and it will go to where there's infection. And then you can see it on a hotspot. You can put phosphate on there, and it goes to the bone to see where there's bone turnover. So that's how you use technetium. But in a thyroid scan, you just use technetium unlabeled, and it actually looks like iodine. It also looks like chloride. So it goes to salivary tissue, and it goes to the stomach.
So it's basically a scintigraphy?
Yeah, it's scintigraphy. Did I answer that question on it? So clinical signs, but we're seeing what they're reporting is T4s are coming from the labs in a false positive now. And one of the things that they ended up doing is the original equilibrium dialysis test that was done, they're using not the same test. They've actually changed it a little bit. And so it's actually not as sensitive and specific as it was previously. So it's leading to a lot of false positives. So we're starting to see, we have a dog too, came in. We can't find why the T4 is up high. The dog's not clinical. We cannot find overactive thyroid tissue on this. So we're getting this more and more, which really is why we do the thyroid scan prior to treatment, because clinically they don't have it, blood work they have it, treat these guys, you're treating normal thyroids. So it's really important to do that thyroid scan. The free T4 by ED has a really high sensitivity, 98%, but its specificity is not good. So that's the 20% of the sick euthyroid cats have an elevated free T4. So they put them into that hyperthyroid range, even though something else is causing them to lose weight. And you think, well, I did the free T4. The T4 was normal, somewhat normal, maybe a little bit out of range. Free T4 tells me it's out of range. The cat's losing weight. Keep this in mind. 20% of those sick cats actually have sick euthyroid, and the free T4 is up. So they're not truly hyperthyroid. If you get into a jam like that, the thyroid scan will tell you whether or not they're hyperthyroid. The technetium
What
scan.
are your indications for running a T4?
The indication is that if you have the cat that is borderline on the T4, but you're just not convinced, cat is somewhat clinical, I would run the T4 on that, because it does. If it's another piece of evidence. And then the last step, which is the safety gap, is it gets a thyroid scan. And we can tell from that if it's real. So you can, but in-house, you can do that in terms of the free T4. If it's in the normal range, hyperthyroidism is probably less likely.
So if you do have a cat that's in the high normal, the upper 1/3 of the total T4,
Yeah.
and its free T4 comes back elevated, would you tell it if it was euthyroid sick if it just didn't respond to methadone?
No, because the T4 actually with euthyroid sick should be low. So that's the difference. In the hyperthyroid cat, high T4, high free T4. The euthyroid sick, low T4, high free T4.
Even if the total T4 was still within the normal range, but in the high normal range?
Yeah, and that's where it comes down to the patient. Is it an older cat? Is it showing clinical signs? Are you seeing some of this other stuff? It gets tricky though when you have that, the apathetic hyperthyroid. It's not easy, and so then it really comes down to the test that's going to tell you is that thyroid scan, because that will, you can't fool it. It will show the technetium, the uptake, and then the ratio. So
I have a question that's unrelated to the hyperthyroid.
then we're not going to talk about it.
Come on. Come on. I have a 3-year-old Jack Russell who consistently comes back with his T4 being a 0.2. Jack Russell, you know, he doesn't look like he's low thyroid. With a thyroid scan, tell me whether or not there was something going on with the thyroid.
I probably would look more like a TSH test, something along those lines, because.
did that.
And what did that come back as?
It's fine. It was in normal range.
Well, then he probably can't be hypothyroid. His TSH should be sky high to stimulate those thyroids.
But why does it? Because at first I thought maybe it was my older dog's blood, and the tech had switched it, you know, because I'm like, okay, this doesn't make sense, but it just keeps coming back, 0.2, 0.2 every time.
I don't know why he's coming back. Some reason not picking it up. And I was going to say, while Abbott, she walked out, but while Abbott's great, some of the lab tests suck.
Okay, all right, thank you.
I really, the lab tests, and more I look at the literature, they're just throwing outliers there. And the TSH, we can talk later about it, but TSH on a low thyroid should be sky high. TSH on a hyperthyroid should be 0. And you can use that sometimes.
Would be a case that you would like to test the autoimmune disease for anti-thyroid?
Looking to see if it's taking the thyroid and attacking it.
Well, some of these dogs have antibodies against their own thyroid function.
Right. Now you're getting outside that area, because the dog thyroid and the different things, talk with the internist on that different stuff. Really don't deal with a lot of the thyroid issues that I have to actually kind of on the dogs. So I don't want to misspeak on that. But I know the TSH, I understand the TSH, but I don't know the exact mechanism of the low thyroid in the dog, if it's an autoimmune, which okay. I really don't remember, I'm sorry. So, so they use the T4 with the sick euthyroid, it's typically lower. All right. So the tech scan, there's a difference in terms of if the animal's on methimazole or off methimazole. All right. Typically we look at a ratio of 1.2 to 1 on the thyroid to salivary ratio. On methimazole, they can actually be a little bit higher in the normal range, 1.5 to 1, because their T4 is lower, so they're actually trying to pull in more. And we will look at that and determine if they truly are hyperthyroid or not. Okay? And then the last one is if we can't figure it out, if we want to find out if it's functional in terms of take-up and excretion, then we're going to look at the I-123 scan, or if the technetium scan doesn't tell us what we need to see. This will take, we have to wait 12 hours. So the iodine will get absorbed into the thyroid tissue or tissue that's taking up iodine. It will help us find little areas on that. Not very often we do I-123 scans, but it's there as an option. So the thyroid to salivary ratio, I said it's not perfect, but very good. It's very good at identifying, is this animal hyperthyroid or not? People looked at it in terms of, can it be used to determine what dose to give? No, it doesn't do that for you. But it does help in terms of saying, yeah, the animal's hyperthyroid or not. This, and if you come across a paper, they looked at saying that there was a lack of inter-examiner agreement, but it was really with higher densities. When you look at a thyroid to salivary ratio of 5, 6, 7, well, then someone gets 5.5 versus 6.5. That really doesn't matter, because it's really a simple yes or no. Is this a hyperthyroid animal or not? And once you get in above 2, it's not a question of, well, I got 2.2 and you got 2.4. That's academic stuff. It's just not, in the real world, it doesn't matter as much. So the reason that's happening is the salivary region is variable in terms of how much saliva is there. That's where it's getting in there as chloride. They swallow. If they're not producing saliva at the time, you'll get a different background of the salivary counts. So that's not, but we can always use that in terms of thyroids. We'll see 2 normal looking thyroids, and then the salivary, and if it's 1.2 or below, and you have a high T4, we can tell you it's not hyperthyroid. Something else going on there. Probably lab error, something going on. T3, they talk about total T3. The problem is that there's so much overlap, 25 to 30% of hyperthyroid cats have a normal value. So don't even bother with the total T3. T3 suppression. This test is actually not too bad, but this is the big key to it. Owner compliance. They have to give 1 dose every 8 hours, 7 doses. They have to get a pre-T4, and they have to get a post-T4. So it gets to be a very big test over 3 days in terms of getting the owner to do all of that. So while it works, it's not the easiest test to do. Okay? But if it's the T4 doesn't get suppressed as much, or if it stays above that 20 nanomoles per liter, then it's consistent with hyperthyroidism. If their T3 suppression drops it to less than 50% of original value, or less than 20 nanomoles, then they're euthyroid. Okay? TSH level. So mentioned this, touched on this. We don't have an assay in the US. In Europe, they have an assay for TSH that's feline, and it actually was very accurate. We don't have it. So they use the canine for TSH, all right? And they're looking at actually TSH level. And the problem here is that it only detects about 35% of TSH, of cat TSH. So if it comes back normal TSH, the animal's not hyperthyroid. There's no way to fake that one. But if it comes back low, you don't know if the animal's truly hyperthyroid or if it's because the assay just didn't detect the feline. All right? So the higher the T4, it's going to have a negative feedback and stop the thyroid stimulating hormone from being produced. So TSH will drop down to close to 0. So that's the problem with the TSH level. But if you get a normal TSH level, it's not a hyperthyroid animal.